My name is Tom Hayes. I'm Director of Customer and Community Relations for New Jersey Natural Gas Company, and I'm happy to welcome you to SCAN's Community Connections program, where we really talk to wonderful organizations in the Monmouth and Ocean County area. Today I'm honored to have with us Joan Wills, who's the Assistant Vice President of Geriatrics at Monmouth Medical Center. She's going to be telling us about their services and programs. And Joan, I know we've known each other for years, and you're certainly a wonderful person, and work for a fantastic organization that I know at SCAN we're very indebted to, because we have a really good partnership and all that. But you in particular have always been a great friend of the organization, and but obviously a friend of the whole community in the wonderful work that you do. So we're honored to have you here with us today.
Oh, thank you, Tom. I'm really happy to be here, and happy to be talking about community connections, because it's really important to the work that we're doing.
Oh, for sure.
Really
for sure.
important.
So I guess that my first question for you is really, what is your new role at Monmouth Medical Center?
Great question. I'm figuring that out too.
Okay.
My new title is Regional Assistant Vice President for Monmouth Medical Center and also for Kimball Medical Center.
Great.
So I have a regional role.
Good.
And what we're doing is expanding our geriatric services, also palliative care and diabetes education. So I'm really working over those three areas to develop our programs even more than we have already, and to bring it back to the Ocean County community as well as our Monmouth County community.
That's excellent.
So it's pretty exciting business right now.
That is great. And
Yeah.
as you know, SCAN is both in Monmouth and Ocean County.
Yes.
So the fact that you're going to be there and being another, player in the Ocean County scene with all that is excellent. And I know our viewers are both from Monmouth and Ocean County, so I'm sure they're happy to hear that too. So so it's great. I look forward to continued partnerships and growing partnerships, because certainly Monmouth Medical Center has been doing a wonderful job, and Kimball also down in the Ocean County area. So we're really great to have you involved with both.
Oh, thanks, Tom. We are really looking forward to this expansion into the Ocean County community. The seniors there are very large in number,
yes,
and probably the fastest growing population in the nation. Right. So as we're expanding our services, we're really happy to be able to bring them there as well.
Right, and I have to say, for being involved with SCAN for over a decade myself here, our seniors are wonderful folks, and there's so much good there, and so much knowledge, and there's so much to offer, and keeping our seniors healthy is critical for our society. So it's really wonderful to know that you're there and going to be helping out even more than you do already, which is great. It really
Thanks,
is.
Tom.
Certainly.
And for us, it's our seniors, and it's also for those who are caring for them. It's so important. Yeah. Our family members, the people in the community who are doing so much to help us to keep them at home as long as possible. And that's really what we're looking to do, and these community connections help us to do that.
That's great.
Yeah.
This is really wonderful. So what are the clinical services provided for their senior population?
There's lots that's out there. At Monmouth Medical Center, we have a geriatric health center. We're very proud of the team. The team includes 3 fellowship-trained and board-certified geriatricians, 3 women who are very experienced in senior care, and we provide the full realm of care for our patients over the age of 65. Excellent. We also have a memory disorder program, so we're there for memory disorder, especially assessments if you're thinking there's something that you want to know a little bit more about with your memory. And then we also have a transportation program. We have caregiver groups. We have social work. A social worker who is definitely dedicated to the program, who is really seriously experienced with lots of senior issues, and is a wonderful resource. And also, the director of our program is also a social worker, and she's bilingual. So that adds a really nice addition to the program. Sure. Also, we have transportation. So the man who is our transportation coordinator is an extremely important part of the work that we do.
That's great.
Our geriatricians are Dr. Jessica Israel, who guides our programs, as well as Dr. Priya Angie, and also Dr. Shira Goldberg. She's the newest member of our team.
Great.
Yeah.
It's nice to see your team is expanding and bringing in new people and all that all the time, right?
Yes, it
So
is.
It's important.
Yeah, all these community education programs, we're working with SCAN to do even more. The Alzheimer's Association is actually doing some programs on site with us now, which
Great.
we're finding to be another big positive. And for the Kimball Medical Center in Ocean County, I actually met with the Ocean County Health Department yesterday. They're a fabulous
They
resource
are, aren't they?
for the seniors in Ocean County.
They are
They
great.
should really pick up the phone and call if they have any questions for across-the-board issues for seniors there. And there's a lot of community education that we do out of Kimball as well. There's actually a Center for Healthy Aging. Isn't that a good name?
Yes, absolutely.
Isn't that a good name? Center
Absolutely.
for Healthy Aging. That's what we all want to be doing.
Yes.
Healthy aging. So lots of programs around that. And we're
Right.
expanding all of that. Dr. Israel's going to be working with us down there also in an administrative capacity, helping us to grow that program.
Excellent. And it's wonderful. It sounds like you're covering all the bases, and transportation being an important one, because
Very.
as we all know, there's issues that affect a lot of us. But if you really can't get to your doctor or get to the care,
Right.
you can really go down very quickly. So the importance of having a transportation element
Right.
is really critical, and that's great that you've thought of that and cared enough to put that in place.
It is critical and something that you really need to look at carefully and follow up on.
Right.
Because it just doesn't go away from today.
Right,
So,
and again, as a healthcare organization, you're doing what you need to do with inside the walls of the hospitals and the facilities that you're working in. So
Right.
to think outside the box and think about the fact that these folks actually need to get to your facility is great, because unfortunately in Monmouth and Ocean County, the transportation system, because of the way it's laid out, it's just not there to really get people from most communities into the centers and
Right.
locations. So it is really great that you've thought of that and included that in your programming.
yes, we definitely have.
That's great. Now,
Thank
what
you.
kind of education programs do you offer to the public?
Well, we do professional public education programs where we have social work and physician and nursing education credits.
Okay.
We have one coming up that's for the the care of the frail elderly with dementia. We have a team who's really put together the faculty for that, and we're very proud of that program. We've done it a couple times, been well received, and so we're doing it even more. And then we have all kinds of community programs. We're working with SCAN on total brain health.
Yes, that's
It's
great.
really an initiative that we've adopted together. So the community education that we're doing from the medical center side and also with SCAN is incorporating all the pieces of brain health, because there's so many pieces to it.
Yes.
Protecting your head, don't
Yes.
fall.
Yeah.
Yeah,
Right.
things that you wouldn't necessarily think about, but also we had a wonderful workshop here at SCAN where we had interactive stations. So there were 10 people who were actually here doing things like juggling and answering questions for games and all kinds of things to just really prompt people on things that you can be doing to keep your brain healthy.
Right, which is excellent. And again, being involved with SCAN, I know how much you guys do, and what a wonderful sponsor you are of SCAN, which means a lot to our seniors. And I think there's a lot of folks out there that don't even know how much SCAN does,
Right.
So it's great that you see that, and you support that, and obviously continue to grow your own programming. And it's nice when things work together and we can work off of each other's strengths and really get more programming out there for the folks that really need it. So
Exactly.
So I mean, again,
Exactly.
you guys have been right here from day one, really. I know you have been here from day one with SCAN, which is over 25 years now. So,
Yes.
So it's really,
Yes.
really a great relationship. And I can tell you on behalf of SCAN that we really, really appreciate and value that very much.
Thank
We
you,
know how
Tom.
important and critical it is. And it's really nice to have partners who care and get it and understand it.
Yeah. And Dr. Vozos, who's the president of our hospital, is extremely supportive of all of our efforts with SCAN. So,
Yes, he's a great man.
Isn't he?
Yes, he really is.
I
He's
agree
really-
with you.
We're blessed to have him in our community as well.
We really are. We really are. And that message gets out very clearly. So
Mm-hmm.
it's really wonderful to be working in that kind of an environment.
Yes,
Mm-hmm.
it's a great environment. Anytime I have to do, and I deal with a lot, as you know, in the community, but anytime I deal with the folks at Monmouth Medical, it's always a very good feeling. It's always a good conversation. It's always a helpful, positive conversation, and
Great.
really, really great folks. So you're part of a wonderful team,
Thanks.
and you do a very good job in representing yourself. I can say that from experience, that you're a kind person, a good person out there in the community, so that's important. Tell me, what are the transitions in care, and why are they important for seniors?
Transitions in Care is kind of a new program in the last 5 years. It's not new today, but when we're talking about community connections, I think it fits in beautifully with transitions in care, because we are no longer able to just look at where we are in the hospital. You know, it's like a silo. We take care of our patients while they're in the hospital. Now we say what happened yesterday and what's going to happen tomorrow, so that we can help with all of those transitions that have to happen for our seniors. They go from home to the hospital, home to the emergency department maybe. They could even go from home to the acute rehab hospital these days. Or what would be the right transition for them to make when they have a medical issue?
Right.
If they made the transition from home to the hospital, then where is the next step? And then what's the step going to be after that? Healthcare has gotten very complicated.
Yes.
Hasn't it?
Mm-hmm.
For those of us in healthcare, it's really complicated.
Yeah, for the rest of us, it's amazingly complicated.
It really is. And so we need to be able to guide our patients and through the different transitions that they make. So that's what that transition word is about. We've actually developed teams for transitions. We have a very successful program around heart failure. Sharon Holden and her team have done amazing work there. We started out with the frail elderly with dementia on the team that I was working with, and now we're expanding that to complex medical patients. So now we look at our patients from an interdisciplinary approach. So we're there with the social worker and the case manager, with the geriatrician, also with the social worker and the physical therapist. Maybe nutrition is the issue. Maybe eating is what needs to be looked at.
Right.
What are the whole issues that are impacting this? And then when we're going to make the move from the level that you're at, what's the next step that needs to take place? So we're doing phone calls at 24 to 72 hours, and then also again at maybe 15 to 20 days to see that across that transition, things are happening the way that they should be.
Right, right.
Monmouth County Office on Aging is a wonderful resource where people can
partner,
call.
aren't they?
They're great. You can call and get what additional resources are out there in the community. Ocean County, I was so impressed with them yesterday.
Yes.
They're really wonderful.
They
If
are.
you've got an issue and you're dealing with and you're looking for guidance in whatever that might be, that's a really good place in your transition to make a call.
Right, which is great.
Really
Speaking
great.
of calling, is there a contact number that folks could call if they wanted to really take advantage of your services or learn more?
Absolutely, absolutely. My personal telephone number at Monmouth Medical Center, where you get me directly, is 732-923-6543. And I have an email, which is jwills@barnabashealth.org. So happy to have people contact us directly. Our Geriatric Health Center is also available, and that number is 732-923-7550.
Wonderful. That's
So
great.
any of those numbers, we're happy to talk with people. Sometimes it's a conversation that needs to start to get you to the next step of where you want to go.
Right.
So, and sometimes that's a difficult step with our seniors in some of these really complex situations that are going on.
I agree. It's tough.
When I started with geriatrics, I thought everyone who'd be talking to me would be the professionals. You know, the doctors, the nurses, the social workers, about what we're doing in our care. I find now when people find out that I work in geriatrics, whether they're all of those people I just discussed, they all give me their personal experience. We're all having personal experience with challenges these days.
Right.
And
right.
so
That's
it's really
great.
important to have a place to call.
Well, again, I want to thank you for being with us. Again, I really want to reiterate for SCAN how fantastic it has been to work with you guys and all that you've done for SCAN over the 25 years. And to see that you're expanding your programs, and certainly, you know, your particular involvement is wonderful. We appreciate everything you do, and we thank you for being here with us.
Thanks, Tom. It was really wonderful to be here, and let's keep these community connections going.
You got it.
Really.
Very good. So we're going to be back after an important message with our next guest. So stay with us. Thank you.
Now's a great time to make your home more energy efficient, and the New Jersey Natural Gas Save Green project is here to help. Take advantage of rebates and incentives up to $15,000, designed to make your whole house more comfortable, improve performance, and save you money. Upgrade your older, inefficient heating equipment, central air conditioning system, and water heater with money-saving, high-efficiency equipment. But don't stop there. Your new equipment will have to work harder, wasting energy dollars if your home is not properly weatherized by reducing air and duct leaks and installing proper insulation. Call the Save Green Project at 877-455-NJNG or visit savegreenproject.com, and we'll help you get on the road to maximum energy efficiency and savings and explain how you may qualify for up to $15,000 in rebates and incentives. Call Save Green at 877-455-NJNG.
All right, well, welcome back. Again, I'm Tom Hayes, the host of Community Connections here at SCAN. And we have a wonderful guest with us for the second part of the show, and that's Major Kevin Stoops of the Asbury Park Salvation Army. And Major, it's wonderful to have you here. I know
good to see you, Tom.
I know you do great work. I know we work together on different programs and with your advisory council and all that. But now it's time to share all your good information with our community. So again, it's an honor to have you here with us.
Glad to be here, Tom.
It's great.
Nice to talk to you.
That's nice to talk to you too. So like many people know about the Salvation Army, whether it's the ringing the bells at Christmas and all that, or the red trucks that are riding around in our community and all that. But what can you tell us about the Salvation Army that many people may not be aware of?
Well, there's just so many activities that the Salvation Army does which aren't so public as ringing the bell or the red truck driving around. Each week at the Salvation Army there are activities for the entire family to be taking part of. Right from the acquisition of life skills in the lives of children up to socialization programs for adults and for senior citizens. And these are things that happen week in and week out, which really don't get a lot of publicity, but are very integral to the life of a community and to a family's life.
I mean, it's a great organization. Again, and I know you've been in Asbury for like 130 years, is it? Something like that?
130 this year.
130 years, wow,
130
that's great. Which is amazing when you think about it. And probably, I think, one of the original nonprofit organizations in the city. I don't know if anybody else that's been around that long there. So
I think you're correct.
That's pretty impressive. And again, I know your organization has been very active all through those years. It's not like there was a quiet time or you stepped away or anything like that. You've always been right there for the community there, and which is great, and it's wonderful. And I know you and your wife Sherry Ann is you're doing a great job at the Asbury
Appreciate
Park
that.
location. We very much appreciate your being there too, which is great. What is the Salvation Army doing for children and to help keep them out of trouble these days?
As many people are aware, Asbury Park currently is having a lot of difficulty with incidents of shootings, gang activity. There's a huge amount of heroin in the area. And one of the strategies that we have at the Salvation Army to try to help that into the future is we've got to get the children and really teach them life skills which will be useful to them so that they don't turn to drugs. They don't have to go to the gangs. So we're doing that in multiple ways. First of all, we're a safe place.
Right.
So we're here to provide after-school programming for children to come. Families really enjoy that, a place for the children to come after school, maybe when they're not back from work yet, but they know that the child's at the Salvation Army and they can enjoy activities using our gymnasium or craft activities or homework help at the Salvation Army. But more than that, we have scouting type activities every week for boys and girls, which would help teach them life skills. Basics of sports to cooking to etiquette to manners, all those kind of life skills which maybe we're seeing going by the wayside, which we still see as very vital to the development of a child and will help them later on. But we also know that we need to keep kids off the street.
Right.
So every week we open our gymnasium up to boys, younger boys first, to play basketball. They first learn skills and drills to learn how to play the game, but then they can enjoy an activity. We started that with 4 boys. This past Tuesday we had 19.
Great.
So the parents are really enjoying the fact that the child can come. Again, you're talking about 6 o'clock till 7 at night. They're able to come and enjoy their favorite sport of basketball, which is big in Asbury Park area. But the most exciting part is from 7 till 9 when the older boys come, 14 to 21. And they come. This past week we had 31 boys in. We've had as many as 45 of the older boys. And this can be a rough crowd. We have awareness that some of these boys that come into the gymnasium are gang members of the area. And we know that the choices that they've made up to this point may not be the wisest of choices. They've maybe dropped out of school. They may have turned to drugs. They might be involved in gangs. They're having difficulty getting work. And so, but they love the game of basketball, and they are interested in a safe place. Prospect Park isn't necessarily a safe place for them to go, especially in the wintertime. But
Right,
in the
it's cold
summer, it's too many people around. There's a lot of activity that maybe they don't want to enjoy. I firmly believe right now we're 1 day a week playing basketball, and we have that many guys that love to come. And they tell us the reason they come is because they enjoy the game and we're a safe place. I think if we could open that gymnasium up every night of the week, we'd have guys that would come every night to play the game.
Now, what do you need to do that?
That would be supervision. I mean, me personally, I'm doing it now, and I can't
You can't do it every night.
Can't do it every
right.
single night.
Right.
So it'd be people that are interested in working with the urban young man who has an edge to him and is not going to be shocked at it and is going to do it. What I find is tremendous respect for me as a person by the guys who come, tremendous respect for the place. They sort of call each other on language and on if they're getting out of control in a temper way. And very appreciative. So when we leave at the end of the day, every single one of them will come over and give me a fist pump or a shake the hand and just say how much they appreciate the opportunity to play.
That's great.
But beyond that, Tom, and this is probably the key, is that we know their names. We don't just say, hey, you know,
Right,
we know their
right.
names. You know,
It's important,
Dashir,
sure.
Raheem, Javon, we know all their names. And they like the fact that when they enter the gym, we call them by their name. They're a person
Right,
when they come
sure.
in. And so what we've been able to do is build up relationships with them. And I'll just tell you real quick, just about a boy named, I'll change his name here just for this. But, you know, Lewis comes to us, and we just strike up a conversation and come to find out that over the Christmas break, his daughter had died. Now, you're saying, wait a minute, you're 14 to 20, 21, 22. Yeah, he had a daughter who was 1, who had died over the Christmas break. What that allowed us to do was just really be an opportunity for him to share what was going on in his life over the loss of his daughter, what that meant to him, what grief he was going through. And we were able to support him through that, which I think is what keeps him coming. He knows that when he comes to the Salvation Army, he's got people there who's caring for him, not just on a basketball court,
Right.
but also in what's going on in his life.
That's wonderful. It's remarkable. I know we at New Jersey Natural Gas work with you on a regular
Yes, you
basis,
do.
and volunteers doing, especially the Christmas time and all that. And you know, that gym is packed with gifts and toys and all that for folks in the community that need it. And again, it's just one of the many programs that I know you do on a regular basis out there every year, and you go through all this work and effort, and it's a lot of work. I know it's a lot of work, and you know, we love to work with you guys because again, you've always been there. You always continue to do that, and I think that's something that we admire in organizations is that consistency. So that it may not have to be exactly the same every year. Things can change and grow, that's great, but the fact that you're always there, that you continue to do the important things that need to be done, and that if you were to end a program, it would be because the need wasn't there anymore, and not because you just don't want to do it anymore. You know, sometimes the tough programs are hard to keep going, but you do them, which is great. And in terms of like, if you were trying to get the gym open more nights, so you need more help, how would you get more help? Where would you look for help? Would you go to, let's say, the recreation committee in Asbury Park and see if they can give some funding to help you hire somebody? Or, you know, we've got an audience that might be able to help in some way. If they wanted to help, is there a number that they could call to perhaps get in contact with you to volunteer or maybe see how they can make a contribution?
Yeah, there's going to be a phone number that'll hit the screen. I think that's a great way to call. Yes, 732-775-8698.
Great.
Because that will give access then to us to talk about that. I think the key in especially that gym program which I just talked about is if the Salvation Army could have a point person hired that would just oversee all of that activity, because then they could be in charge of any volunteers that are coming. If we just sort of run it like, okay, one person's here one night, another person's another night, another person's a third night, then you lose some of that continuity,
Right.
which right now the guys are really appreciative of, that they know when they walk in they're going to see either myself or another gentleman who is running it with us.
Right.
So that would be a key, and that's one of the hardest things for anyone that's trying to do work is if you want to hire someone, is the funding for that. So you try to be creative in how you offer. This isn't something new. We started this 14 months ago, so it's new from our perspective, and right now it's just being overseen by a couple of us. But I think that's a key, is that if we wanted to keep going in that direction, because that, like I said, they would be there every day.
Right.
Because of the game of basketball, they love it that much.
And think about that, like, as you know, but for our audience, if they could be there every day, that means those other days they're not out in the street,
That's
they're
right.
not getting into trouble, they're not causing problems, and they really are finding a purpose. And every minute that they're spending with you is giving them an opportunity to learn a different side of life. And, and as you said, to realize that there's people that do care about them.
Yeah.
And that often can lead into other parts of a program, or maybe there's something else that you do that gets them into the next step where they really learn to help themselves and mature in a way that's important for all of us. And when we talk about our future generations, with, like you said, the heroin epidemics that are going on in this area, and kids just being involved in things that they shouldn't be, and so much on the internet that's really pulling away from the fiber of our community. Yeah. It's nice to have a safe place, and it's coming back down to the very basic elements of playing games together.
Yeah.
Whether you're playing tiddlywinks as a little kid or you're playing basketball as young adults, it's still the concept of being together, doing positive, good things together. And with that, I think really can spur a lot more good for those kids in particular, and for the community. And for Pete's sakes, what are we on this earth for? But if we're not helping each other,
Right.
so.
And we're making it available. Anytime we're hearing of jobs that are open or available, we post it so these guys can at least be looking at it and seeing it. We're giving them counsel about what it means to go to an interview. You don't go, dressed with your hat on backwards, and
Right, and you got to keep your attitude and check a
that's
little
right.
bit and
Yeah.
know who you're dealing with.
That's right.
Nobody wants to say we want to change you completely or anything like that, but you got to know the situations that you're in, that you have to act appropriately. And I think
right.
that's what a lot of kids are missing these days, especially when they go on interviews. If they haven't had some coaching or some help, and a lot of these kids may not have the family structure at home
That's
where they're helping them, and we must kind of assume people should, but they don't. So when they can come to an organization like yours and get that little helpful, and know that it's really sincere and honest and in a loving way, they know that they're really getting some good guidance, they'll listen better, and maybe they'll take that to heart and say, okay, I got to watch how I interview, what I say,
right.
the way I react to things, and know that the person on the other side of the table is not your enemy, but actually somebody who could help you greatly in the future, but you got to get in the door. So
Yeah, with this group you have to earn your voice, and we've earned our voice because we've built up this relationship over a game. The
Right.
game is not the important thing, it's being able to establish the relationship so that now I have a voice in other areas of their life.
very true.
So that's why that's become so crucial to us.
That's great. And so it's good you gave the number so folks can give you a call and hopefully help in some way, whether they want to volunteer or,
Sure.
again, donate funds. Again, I know it's very important, as to most of our community partners, that you need support out there. So that's great. But I do want to, again, commend you and Sherry Ann for doing a wonderful job at the Asbury Park Salvation Army. And I do know that facility very well,
Yes,
and
you
you
do.
keep it very well. I mean, it was built not too long ago in this overall scheme, certainly not 130 years ago, but it's a great facility. We appreciate the fact that you're there. Asbury Park needs you, and continue to do good work. And thank you very much for spending your time with us.
Thank you, Tom, I appreciate it.
Okay, very good. Well, thank you, everybody. We appreciate your watching today, and we look forward to seeing you in future programs. Take care.